Good afternoon. I will talk briefly about predicting the LLD using the multiplier method and the multiplier application. I'll start with an example. This is a 7-year-old male patient with congenital short femur and fibular hemimelia. At the age of 7, we wanted to start the first lengthening of the tibia with external fixator. The femur was planned to be lengthened later with internal device. After the osteotomy and the frame fixation, we need to plan the amount of lengthening needed to achieve equal tibial length at skeletal maturity. Projected LLD is the leg length discrepancy after the end of growth, estimated for the skeletally immature patient. A good estimation of the final LLD has a very practical implication. It can help us decide the treatment method, conservative treatment for the negligible LLD, arrest of the growth or shortening for mild LLD, lengthening for severe LLD, or even amputation for non-reconstructible lower limb. It can also help us decide the amount of lengthening needed and in which bone, and decide the timing of the surgery. Rough estimation of the LLD can be done using the average growth velocity of each growth plate and the average age of physis closure, 14 for boys and 16 for girls. We can use this method only when there is complete closure of a specific growth plate, like example after a fracture. This method is based on the average growth velocity, and it's not accurate due to the fact that the growth rate is not linear and changes with age. The multiplier method was published by Pelly and co-authors in 2000. For congenital deformities, it is based on the fact that the ratio between the difference of the leg lengths in different ages tend to be constant. So if we subtract the short limb bone length from the long one and multiply it for a constant from this table, according to the patient age and gender, can you see the mouse? Here are the different ages and boys or girls. We're supposed to get the estimated LLD at maturity. Of course, we could not remember the whole table, but as a rule of thumb, we can remember that for girls at the age of 3 and for boys at the age of 4, the LLD is about half of the final LLD. We'll go back to our patient. His current tibial length discrepancy is about 3 centimeters. He's about 7.5 years old, so as we can see in the table, the multiplier constant is 1.52. If you multiply the LLD by the constant, you can get the projected LLD, which is 4.6 centimeters. Of course, that in the smartphone era, we don't have to use calculator, and there's a smartphone app for the multiplier method. All we need to do is to insert the bone we are talking about, the gender and the age of the patient, and the discrepancy between the long and the short segment. And we can get the LLD at maturity and the LLD at every age until reaching maturity. In this patient, we needed to lengthen the tibia by 4.6 centimeters, and we did it in 2 steps using proximal tibial osteotomies and hexapod frames. Now, if we want to calculate the femoral LLD for the same patient, we choose on the app femur, male patient. He's now 7 years and 3 months of age in this X-ray. The femoral length discrepancy is 1.9 centimeters. After we let the iPhone do the math, we get the femoral length discrepancy will be almost 3 centimeters at maturity, and we can track these changes according to the age. Because we waited with the femoral lengthening until this patient was approaching skeletal maturity, we can use this case to check the multiplier method. At the age of 12, after 2 tibia lengthening and several interventions in the tibia for angular correction, his femoral length discrepancy was 2.4 centimeters, and the projected LLD we calculated when he was 7 for that age was 2.5 centimeters. And at the age of 14 and a half, the LLD was 2.8 centimeters, and the projected one for that age was 2.7 centimeters. Now we have to decide what will be our treatment strategy. We can stop the growth of the longer bone or longer leg, or do lengthening of the shorter one. If we want to choose to close the physis of the contralateral side, the multiplier app can help us choose the right timing to get equal leg lengths at maturity. We choose on the main menu timing of epiphysiodesis. Then we choose distal femur, the gender and the age of the patient, the current femoral length, and the amount of shortening needed, which is the projected LLD we calculated earlier. The app will give us the right timing for epiphysiodesis, which is too late for this patient who is approaching skeletal maturity. So in this patient, we did internal lengthening using magnetic nail, and that's the final length, and the last X-ray is after hardware removal when you got to skeletal maturity. We can use the multiplier method to calculate the projected LLD in acquired or developmental conditions as well. This is a 13-year-old patient with distal femor, Solter-Harris 2 fracture and epiphysiolysis because of motor vehicle accident. On the same day, he underwent the close reduction and pinning of the fracture, and the result is pretty good, radiographic. But a year later, we can see a complete closure of the distal femoral physis. At the age of 14, he has LLD of 1 centimeter, and at the age of 15, he has LLD of 2.1 centimeter. And after we have the length of the two femurs in 2 different times, we can use the multiplier app to calculate the projected LLD. So we choose on the main menu developmental LLD, and then choose the selected bone, the gender and age of the patient. We insert the long and short bone length for 2 different ages. And we can see that the projected final LLD is about 3 centimeters, which might be significant. Now we need to decide if we want to shorten the long leg or lengthen the short one. In this patient, epiphysiodesis is not an option because he's already approaching skeletal maturity, but we might consider shortening. So another consideration we have to take, if to shorten or lengthen, is the height of the patient at maturity. We can use the multiplier app to calculate it too, using the current height and age on the growth chart. So our patient is estimated to be 163 centimeters at maturity. Because shortening will reduce another 3 centimeters from his height, we think lengthening is a better option, and we plan to do it soon. Estimating the projected LLD is crucial before lengthening or shortening procedures. It can help determine which surgery we choose, the anatomic location, and the timing of the surgery. The multiplier method is simple and easy to use and give fairly accurate result. Thank you very much.